Hello everyone, I welcome you to this session, the second lecture of pathophysiology, and to make an overview of what we talked about in our previous lecture, which was about the introduction of pathophysiology. We had talked about the concepts, the major concepts used in pathophysiology, and we had looked at what causes abnormal functioning of our cells, and we also looked at the categorization of these diseases according to the causative agents. We talked about acquired, we talked about genetic, we talked about congenital diseases, and also looked at the signs and symptoms that can be evidenced by evasion or damage of these cells, where we talked of the signs being objective evidences that are observed and measured by a health professional. And we also talked about the subjective evidences, where we talked of those being symptoms that are evidenced and expressed by the patient. So we also looked at how do we investigate for these abnormalities, and what diagnosis can we make, and what would be the uses of these diagnoses. And the diagnosis, we said they could be used in recognition of a specific disease, and having been able to recognize these specific diseases, then we can be able to make appropriate decision of appropriate and specific treatment. So for this lecture specifically, we are going to look at cell injury. And we said the cell injury is one of the conditions that may disrupt that may disrupt the normal physiological processes within the cell. So by definition, cell injury refers to a condition where the normal functioning of the cell is compromised due to excessive stimuli, or when the cell's capacity for adaptation is overwhelmed, resulting in damage. So these cells of ours are made in a way that they have a normal physiological process that they may follow. For them to perform normally, there should be conditions that should be maintained. There should be terms and conditions, and when these conditions are not met, then they perform in an abnormal way. And those abnormal way, when they perform in that abnormal way, we call it pathophysiology. There is abnormal functioning of these cells. So as we have said that these cells can be damaged, and when they are damaged, they are compromised, and that compromise is what we call injury. So the compromisation comes in when these cells' normal states, either their shapes, either their integrity is tampered with. And we said those factors that tampers with the normal physiological states of the cells are stimuli, or they are precipitators. So those precipitators or stimuli will cause injuries, and these injuries may result into cell damage and compromisation. So cell injury can be reversible or irreversible. So these damages that are caused to our cells may be either restored or may not be restored with the time. With our interventions being done, these damages may either be restored, or even if we do the interventions, they may not be restored. So the reversible injuries occur when the cell's adaptive mechanisms can still restore normal structures and function if the stressor is removed. A stressor in this case is that thing or something that inflicts an injury to the cell. So a stressor in this case may be either chemicals, may be either infections that may alter or may cause damage to the normal state of the cell, and later on the cell's functions are compromised. So if the stressor is removed and we restore the normal function of the cell, so those injuries are called reversible injuries. So the reversible injury occurs when the cell adaptive mechanism can still restore normal structure and function if the stressor is removed. And irreversible injuries occur when cell damage is severe and cannot be repaired, leading to cell death. So, in case these cells encounter the stressors, there are some mechanisms. If these stressors are removed, the cell undergoes a series of events, and those events, we call them mechanisms, through which a cell adapts to what has happened in order to restore their normal and original states. But sometimes these cells, even if they go under those mechanisms, they are unable to restore their normal states even if the stressor is removed. So those injuries that have irreversible restoration of normal physiological process, we call them irreversible injuries. And those irreversible injuries are caused by the following stressors. So the causes of cell injuries include chemicals, they may include biological agents, they may include cold or extreme temperatures, where the extreme temperatures may either be high temperatures or low temperatures. So in this case, if these cells are exposed to coldness, they may be injured. If the cell is exposed to radiations, it may also be injured. And if these cells are also exposed to infections, they may also be injured. And they may also be injured when they are exposed to trauma, when they are exposed to high heat, when they are exposed to ischemia. So these different stressors may cause injuries, and we are saying the injuries may be categorized into either irreversible injuries and reversible injuries. And in details, we are saying these causes that we have talked about can be classified as either physical causes, and these physical causes include mechanical trauma, and this mechanical trauma impacts force and tear to the normal state of the cells. And these may include cuts, they may include scrapes, the burns, crushing injuries. For example, when one is involved in a car accident, we have distortion of those normal cells, and these normal cells, when they are distorted, they no longer perform the way they used to perform. So these mechanical injuries or mechanical causes also may be one of the causes why these cells may perform poorly or abnormally. And we said those abnormal functioning is called, that abnormal functioning is the pathophysiology. So the radiations can also cause these cells not to perform well, or they may cause cell injury. So these radiations, as we are saying, they have a high wave index. They are strong waves that may distort the integrity, or they may distort the membranes of the cell. So we are saying in this case, for example, if these cells are exposed to high waves, for example, X-rays, these rays are they have high voltage power to destroy and penetrate deeper tissues, and for them they are very, very non-specific. They end up destroying both functional and non-functional cells, and at the end of it all, these cells are overwhelmed. These chemicals or these radiations become so toxic to these cells to withstand, and they end up being injured. So the extreme temperatures such as freezing or overheating, these extreme temperatures, we are aware that they disturb or distort the normal physiological processes of the enzyme activities within the cell. And we are aware that our enzymes in the body are made up of proteins, and these proteins are denatured by extreme temperatures such as extreme heat and extreme coldness. Therefore, there is need to keep the cells within optimal temperatures to avoid cell injuries by extreme cold air or by extreme cold temperatures and extreme high temperatures. So in addition, we are saying these cells may also be denatured by electric shock. So the electric shock also may cause damage to the cell's membrane, and when the cell membrane is disrupted, therefore their functions is also altered. So in cases someone has an electric shock, when someone touches the live wires in this case, and for a long period of time, we have seen people getting some death or getting some complications when there is an electric shock exposure to them. So the electric shock may also disrupt cellular function and cause cell injury. So how does this electric shock disrupt cellular function? So the electric shock can disrupt ion gradient across cell membrane, leading to electrolyte imbalance and cellular dysfunction. And this can affect the membrane potential. As we are aware, this therefore can result into cellular signaling and osmotic imbalance, and ultimately leading to cell injury or death. That is how the physical causes can lead to cell injury. Physical causes such as mechanical trauma, radiation exposure, extreme temperature, and electric shock. The next is chemicals. So the next cause of cell injury are the chemicals. So exposure to toxins such as pesticides, heavy metal, drugs, alcohol, these ones, they disrupt or damage the cell membrane because these are poisons. The word toxin means poison. So these pesticides, heavy metals, drugs, alcohol leads to damage or burning of cell tissues. We have seen people coming up when they're exposed to like acids, corrosive chemical damages the cell membrane. The solvents also dilapidate the membranes, disrupting the cellular function. It removes or it disrupts the fat membrane of the cells, and this one disrupts the entry and exit of chemicals or nutrients within and outside the cell. Then oxygen deprivation. When these cells are deprived of oxygen, they become hypoxic. Of course, the oxygen is very essential for energy production during metabolism. When these cells are supplied with the blood, which has nutrients such as glucose, it needs oxygen to burn this glucose during aerobic expression and produce ATP that is necessary for them to function properly, meaning that the depletion of oxygen will lead to no burning of this glucose with oxygen, and we may end up having anaerobic respiration that may result into production of acids that usually burn the membranes, and that one will also disrupt the normal physiology of our cells. In addition to the mechanical or physical factors or physical causes and chemical causes, we also have biological causes of cell injury. So cells can also be injured by biological factors, and these biological factors may be infections such as viruses, bacteria, parasites. These ones damage cells directly or by releasing toxins. Of course, when there is evasion of these infections, or when there is evasions of these infectious agents, the evasion itself will need attachment or colonization. So when these microorganisms enter into a cell tissue, they have to attach. They have structures that help them to evade or to dig and erode surfaces so that they are able to stick on these cells strongly for a long period of time. And these damages caused by these microorganisms in an attempt to have strong adherence to the cells may lead to injury. Or they can also lead to cell injury by releasing toxins. These toxins act as they are produced either to prevent attack by the immune system when they enter into our bodies, and by the in a long run they lead to burning of these cell tissues. So another biological cause could be the immune response. Sometimes when the body recognizes that in the body we have a foreign particle, for example, if there is evasion of microorganisms, there is that immune response where there is a reaction between the antibody and the antigen. The immune system produces antibodies to go and attack the antigens, and in so doing, this immune system may fail to differentiate between self and non-self cells. So one of the uniqueness of the immune system is recognition of self and non-self, identity of specificity of specific cells, differentiating what cells belongs to the body and what cells do not belong to the cell. So this autoimmune disease may lead to attack on health cells by failure to identify non-self cells and self cells, and these antibodies, when they are produced, they end up crushing or injuring both normal cells and abnormal cells that belong to the body. Then another biological cause is the nutrient deficiencies. So nutrient deficiencies is lack of essential nutrients into our bodies, and we are aware that these nutrients are used for energy. So some of these nutrients, when these cells lack these nutrients that are essential to their cell membranes, for example, that they are essential in production of energy. We have seen that these cells also require glucose to burn using oxygen in order to generate energy, so that they can also process their physiological function very well. So, but the lack of these essential nutrients also disrupt cellular processes. For example, these nutrients are needed like glucose, fatty acids, and amino acids. Their deficiencies can lead to reduced ATP production, and therefore reduced ATP production can compromise cellular function and viability. And in addition, these nutrients, when there is impaired protein synthesis, they can, such as amino acids, the lack of amino acids can lead to impaired protein synthesis, and of which protein synthesis is a very key process that may lead to, that is essential for these cells to work very well. And this impaired protein synthesis may lead even these enzymes not to be formed within the cell, or to be formed poorly, and we are aware that most of the cellular activities are activated by enzymes, and this may affect the cell structure and function. And in addition, some of the nutrients are oxidative, may lead to oxidative stress. Certain nutrients such as vitamin C and vitamin E and minerals like selenium, zinc act as antioxidants, and therefore they protect the cells from oxidative stress. So when these nutrients are in less amounts, they cause cell damage to cellular components such as DNA, proteins, and lipids. The essential fatty acids also play a vital role in maintaining the integrity and fluidity of the cell membrane. Therefore, their insufficiency or their deficiency in these fatty acids can lead to alteration in membrane structure, function, affecting cell signaling, transport process, and overall cell viability. And in addition to nutrient deficiency, impaired DNA synthesis and repair can result, because the nutrients like folate and other vitamin B are essential for DNA synthesis and repair. Their deficiencies in these nutrients can lead to impaired DNA replication and repair mechanism, increasing the risk of genetic damage and cell death. Therefore, we should be very key in making sure that the body is well supplied with essential nutrients for the normal functioning of our cells. Another biological cause of cell injury is metabolic abnormalities. Disorders of energy production or waste removal may damage cells. For example, energy disorders such as the failure to provide glucose. These disorders, such as disorders of the kidneys, may facilitate these cells to damage. If there is no functional cells for excretion of waste from the body, there will be accumulation of toxic waste products from metabolism, and therefore these waste products may all end up damaging our cells. So we have also genetic causes of cell injury. So genetics can also cause cell injury. Mutation defects in the genes can lead to malfunctioning of proteins and cellular dysfunction, such as inherited disorders like cystic fibrosis, sickle cell anemia can lead to injury. So mutation mutation by definition is alteration in structure and function of a character determining factor, which is a gene. Any alteration in the gene structure and function may lead to injury of the cell. These genes may give wrong signals to the cells when they are not appropriate at that time. And the factors such as age may be one of the genetic causes, such as age may be one of the risk factors that may cause abnormal cellular injury. So age may also cause cell injury. So cellular repair mechanism decline with age, making cells more susceptible to injury. As one grows, the ability and function of the cell also tries to decline, because these cells wears off, reaches a time when they wear off and become susceptible to any damage, or they become susceptible to injury when a stimuli or a stressor is exposed to it. The mechanism of repair declines. Even if they are exposed to these stressors, it takes time, or they may not be able to adopt and regain or restore their normal physiological processes or their integrity. Then nutritional deficiencies, where a lack of key nutrients can weaken cells. We have seen if we lack vitamin C or vitamin E, which are antioxidants, then these cell membranes are at risk of being damaged. When there is no protein, lack of proteins may mean we are going to have a weak membrane, cellular membrane, that is not able to carry out exchange of nutrients in and out, or exchange of materials in and out of the cell, and this makes them more vulnerable to injury. Then we have also environmental toxins. So the environmental toxins, exposure to pollutants, can also damage cells, especially in an environment where we have toxic chemicals such as carbon dioxide. These chemicals are very toxic to our cells, and therefore these ones also damage the cells, and they may also make our cells being compromised, and they function in an abnormal way. The common pathological processes when these cells of ours are exposed to these chemicals. What are those pathological processes? What are those mechanisms they go through to go and have an abnormal functioning within the cell? We are saying, one, we have inflammation. So the body's response to injury or infection. Inflammation is one of the body's response to inflammation, to a stimuli. So the cells may respond by becoming inflamed. So inflammation is one of the key signals or processes through which these cells may go through, and this it can be characterized by redness, swelling, heat, and pain at the site of cell damage. So when a cell is damaged and you are able to detect redness, swelling, heat, and pain at that site, it is an indication of cell damage where there is inflammation that is due to body's response to injury or infection. So another thing is that these cells may also respond by stimulating the immune response. So the body's defense mechanism against foreign invaders. So when the cell is damaged, the body produces the immune or activates the immune response in preparation to capture the evaders, or in preparation to prevent evasion of microorganisms. And this can be and lead to dysregulation that can lead to autoimmune disorders. So the immune system, when there is an evasion or when there is a disorder in the function of the cells, so the immune system may recognize that abnormal cell as foreign thing. So it ends up stimulating the immune system and produce antibodies. The immune system produces antibodies to come and capture that or react towards that abnormal cell, and at the end of it all, we are saying that it may end up capturing both normal and non-normal cells, and therefore this may lead to autoimmune disorders. And another common pathophysiological process the cell can undergo in is cell proliferation and differentiation. And in this case, there is abnormal cell growth that can lead to tumors and cell cancer. So when these injured cells try to restore, try to regenerate their normal physiological states, their normal structural state, so that they behave the way they used to behave when a stressor wasn't there, they end up growing in an abnormal way, and these tissues also changes and they end up changing into tumors and cancers. What are the adaptations of cells to pathophysiological processes? So we said that when these cells become injured, their physiological events they can go through in order to adopt to mechanisms to work and proceed with their normal function, even when these stressors have evaded them. And these, we are calling them adaptation of cells to pathophysiological processes. So the word adaptation refers to the ability of the cells to modify their structure or function in response to changes in their environment or physiological demands. So this process allows the cells to cope with the stressors and maintain homeostasis. The cell's adaptation is a fundamental mechanism in both normal physiological process and pathological processes. We are saying that when these cells are damaged in presence of the stressors, they also try hard to stay functional even when these stressors are in place, or even when they are removed, to have a continuity of function. And therefore the major adaptive states may include atrophy, they may include hypertrophy, they may include hyperplasia and metaplasia. So these adaptations may be either change of structure, they may either include increase in number, they may also undergo increase in size, and they may also increase a change in shape. So let's look at these adaptations through which these cells undergo after being exposed to these injuries. So one, we are saying atrophy, which is shrinking of cells, and when a cell shrinks, it becomes smaller. So we are saying that these cells, there are some cells that after being exposed to these stressors, the chemical stressors, the biological stressors, the genetic stressors, environmental stressors, some of them they try to modify to see how they can live functional even when they have been exposed to these stressors or when these stressors have been removed. and one of them is that some of them atrophies, they shrink, they become smaller, and we are saying atrophy is the decrease in size and metabolic activity resulting into a change in the size of the cell. And what may cause cell atrophy is disuse. For example, when these muscles atrophy after a prolonged time of inactivity. So when these cells are damaged, the cells are damaged, and a certain muscle, for example, if these muscle cells are damaged and a long period of time elapses without them being functional, they may reduce in size. A case in point is that, for example, we have seen people with the paralysis. So these people with paralysis, or muscle weaknesses, a muscle that is very weak will atrophy than the muscles on the other side that is really active. So the activeness of the cell determines the size of the muscle cell. So if when these cells become stressed and they become inactive, these cells, some of them become smaller in size. So another cause of cell atrophy could be lack of nutrients like oxygen, because we are saying these nutrients are very essential for them to survive and increase in size. There are some of them are used as fuels or nutritional sources. And another cause could be age. We are saying as one ages, the ability of these cells to function also reduces, and some of the muscles atrophies. For example, in elderly people, their skin will shrink, and what happens is that some of these it is an adaptation mechanism where maybe during old age some of these people lose appetite for food. Their immune system is low, and therefore they are ever sick, and therefore the nutrients supplied to these cells are inadequate to maintain the normal size and integrity of their cells. So we have also diseases. So diseases can also cause muscle wasting, such as cancer. So when these cells are exposed to such conditions, they may also try to adapt by shrinking or becoming too small. So apart from atrophying, apart from becoming small, other cells may also adopt these pathophysiological processes by growing bigger in size, and we call that one hypertrophy. So hypertrophy is the increase in cell size leading to larger cells and tissues. This results in an enhanced organ function. So some of these cells, after being exposed to stress, they end up becoming bigger, as we have seen like in myocardial hypertrophy. When the cell muscles are stressed because of being supplied with inadequate supply, the cells becomes big in order to generate and increase the strength of the ventricles so that it is able to push out much blood as demanded by the physiological needs of the cells within the body. So it is the same case here. When these cells are compromised, some will modify their ability to function even in presence of these stressors by increasing their size, leading to larger cells and tissues. and this increase may result in an enhanced organ function. So the causes of this could be increased workload or stimulation. For example, as we have said, in cardiac failure. Cardiac failure is a state where the heart cannot pump out enough blood within 1 minute that is essential and sufficient to the rest of the body tissues as required. So when there is little blood supply out of the body but too much being demanded, the heart looks for other mechanism to increase its workload by generating other sources of energy, and by so doing it increases its size, and we find that the left side of the heart may become bigger. We may have ventricular hypertrophy, and this could be one of the stimulation. Another cause of hypertrophy could be hormonal changes. For example, uterine growth during pregnancy. So under the influence of progesterone, the uterus will grow bigger to accommodate the stressor. Here the stressor is the growing fetus. So when there is increase to grow, there is demand of the uterus to grow in size to accommodate the growing fetus. So the cells of the uterus, especially the myometrial cells, may have to hypertrophy in order to accommodate the growing baby. And we also have one of the causes could be compensatory mechanism for cell loss. So if we have the stressor that has caused, for example, 3 cells to die or 3 cells to become unfunctional, the cells may regenerate to compensate for the loss and increase the size. The left 2, if the organ is made up of 5 cells, and unfortunately the stressor kills like 2 cells out of 5, the 3 cells may try to compensate for the lost 2 cells by increasing their size. By increasing size, it increases the surface area to compensate for the lost ones, so that they maintain their normal function even when the other 2 have been killed or have been unfunctional. So another mechanism or another process that these cells go through to adapt to the stressors and continue maintaining their functions is hyperplasia. So hyperplasia is the increase in the number of cells within a tissue or organ, leading to its overall growth. So sometimes when there is a stressor, these cells also increase their multiplication rate. They try to multiply as more as they can in order to overcome or counteract the effect of the stressor on them, so that they continue performing or they continue trying to perform even when a stressor is available or even when it has been removed, but the injuries caused should not be of more of the concern. So they try to multiply in number, and this the cause of this could also be hormonal stimulation. For example, breast tissue growth during puberty, and there is also inflammatory response, or e.g. the skin thickening in psoriasis, and compensatory mechanism for tissue damage. So if 2 cells have been damaged, then we might compensate by producing more and more and at a faster rate. So we can see that the difference between hyperplasia and hypertrophy is that hyperplasia is increase in cell number, increase in cell number. The downer figure shows increase in cell number. So we are seeing that downward here there is increase in cell number, whereas in hypertrophy there is increase in cell size. So here cell hypertrophy is increase in cell size, whereas hyperplasia is increase in cell number. So another adaptation and adaptation to pathophysiological changes is that these cells can also undergo metaplasia, that is transforming their cell makeup. So the cell metaplasia is change in the type of cell within a tissue. So if the tissue has been squamous, it may change to another type of tissue altogether. So this transformation can be adaptive or precancerous. We have seen tissues, normal tissues, transforming from epithelial to squamous, and either from normal tissue type to either malignant, becoming either benign tumors or malignant tumors. And the causes of this could be due to chronic irritation or inflammation, could either be due to nutritional deficiencies, could either be due to hormonal imbalances. So the cause of transformation of cells could either be due to chronic irritation or inflammation. For example, wounds. If someone has been having a wound, and when that wound is trying to heal, when there is regeneration of epithelial tissues, or when there is regeneration of cells, and again you come and damage or irritate it, so they may end up growing or replacing those tissues with abnormal tissues. A case in point is that when the liver is damaged, the cells of the liver are damaged, the hepatocytes are damaged. When they are trying to regenerate and again you damage them, they may change their way of transforming during healing, and instead of replacing the normal cells with the normal cells, they end up replacing them with the fibrous tissues, the scar tissues, and we end up having liver cirrhosis. So an example of this is like replacement of respiratory epithelium with squamous epithelium in smokers that may lead to lung cancer. So when there is damage, continuous damage of these epithelial cells of the respiratory system by the smoke, continuous exposure to those toxic chemicals that are the stressors can cause cell injury of the epithelial tissues, and when these ones are continuously damaged, they may end up not being able to withstand continuous exposure, and as a mechanism to withstand such, they may transform their status from being epithelial to squamous, and this one may lead to formation of lung cancer. And then another example is the glandular metaplasia in the stomach lining in response to continuous exposure to HCl when there is erosion of the gastric mucosa, the gastric lining, and this may also lead to a transformation into cancer of the stomach. So some forms of metaplasia may be precancerous and require close monitoring. So as the pathophysiologists, we should be able to monitor certain types of transformations, either precancerous before they become cancerous, and we should be able to intervene very quickly before excessive damage or non-reversible changes occur in our cells. Then we may also these cells may also become, they may also adopt the cell injury or the exposure by becoming abnormal cells, and we are saying this is called dysplasia. Distorted cells are called dysplasia. So they may end up becoming distorted in size, shape, and organization of cells with the tissue, which is often in most times associated with the precancerous conditions. So sometimes, because of being exposed to stressors for a long period of time, these cells of ours can also adopt a certain shape or a certain size that is abnormal, or the arrangement of the cells within the tissue may also change, and we end up having a distorted cell or an abnormal cell. And the causes of this, we have seen causes like viral infections such as human papilloma virus that may distort the shape, the size, and the cell organization in the cervical, in the cervix, and this may lead to cervical dysplasia. We have seen cases of HPV, the Hep B virus, the hepatitis B virus. We have seen that the cells of the liver can go under transformation, and we end up having abnormal structure in terms of size, shape, and organization, and this may lead to cell increase in size and or outgrowth within organs, and this may also be caused by chronic irritations or inflammation, and sometimes they can be caused by genetical factors. So the examples of this, as we have seen, in addition, we have seen that these dysplasia or distorted cells, examples may be cervical dysplasia associated with the HPV, as earlier said. It may be intestinal dysplasia associated with chronic inflammatory bowel disease. We also have dysplasia as a warning sign and requires medical evaluation to prevent progression to cancer. So the reason why we have been able to come up with or to have an understanding of these adaptations is also to predict what may be the next step. Which state is this cell? Is this cell under an adaptation mechanism or adaptation process of metaplasia? Is it under dysplasia? Is it under hypertrophy? Is it under atrophy? So understanding this knowledge is very crucial and very important. So in summary, we have looked at cell injury being damage to the normal cells that compromises the structure and function of the cell. And we have seen that there are several causes of cell injury, and these causes could either be chemical, they may be physical, such as they may be biological, may be exposure to certain toxins or poisons that may alter the normal states of these cells. And we are saying that these cells also, when they are exposed to these stressors, they also have to try hard and use mechanisms that will help them to withstand and adopt the stress caused or the injury caused. And I've said that these adaptations or these processes that these cells go through may allow them to survive or continue surviving or continue to tolerate the abnormalities that could be caused by them by stressors. And we have talked about the atrophy being a reduction in cell size, and we've also talked about the hypertrophy being a state where our cells can increase in size in order to overcome the effect of this stressor to them. We have also said that some of them may also increase in number, which we have called we have said that some of them may do what? May increase in the size. They may increase in size. We have said that is hyperplasia, and some of them may increase in size, and we have said that is hypertrophy. So we have said that also they can also do what? They can also change in their type of cells, and we have said that is metaplasia. And we have given examples of metaplasia, and have also said they may also do what? They may also adopt by making their cells distorted. That is in terms of size, shape, and organization. And I've said these may be as a result of the viral infections, chronic irritations, inflammation, genetics, and finally we have talked about the cervical dysplasia associated with HPV and intestinal dysplasia associated with chronic inflammatory bowel disease. Then dysplasia being a warning sign and requires medical evaluation to prevent progression to cancer. Out of all the adaptations a cell may go through in presence of a stressor, the most warning sign, or what we should be worried of, is an adaptational state known as dysplasia, where there is a distorted cell or abnormal cell, where there is a change of cells from one state to another, because we are saying this may be a warning sign to either precancerous or to cancerous. And I also thank you for listening to me during this session, and I would be very glad if I get back to you with the feedback from you responses in case of any question, in case of any supplement, in case of anything. Feel free to ask and contact me anytime, any day, on either WhatsApp, email, and either giving me a direct call. And do not fail to note of my email. My email is petersonmasareka@gmail.com, and you can also get me on mobile telephone number of 0784754583, and the same on WhatsApp. Thank you very much. We shall meet in the next lecture. We can call this session to an end. I wish you the best during your revision time or during the listening of this lecture. Thank you very much. I wish you the best as you come across this and go through it. Very, very critical. Thank you.